is Dr. Stuart Cook. I am a referral veterinary orthopedic surgeon with around about, I think, 13 years of experience of total hip replacements in dogs. And I have managed over, I think, 400 cases now of hip replacements. So I'm going to talk to you a little bit about the why and who and whats of what we do when we're treating dogs with poorly hips and they end up having to have a hip replacement. So the obvious first question is, why do we do this surgery? What is the point of doing it? A clear and obvious reason, of course, is to relieve our patients of pain, but possibly the bigger prize at the end of total hip replacement surgery is about function and getting dogs back to doing the sorts of things that they should do if they were never affected by a problem in their hips in the first place. So running, jumping, playing, dog wars with other dogs, all those sorts of things are a big part of what makes up enrichment in a dog's life, and that's really what we're aiming to give back to the dog at the end of surgery. And the results of this can be absolutely spectacular and very, very rewarding from a professional point of view. So in terms of who is a candidate for the surgery, any dog that has suffered a serious problem with the hip joint, either in one or both hips, is certainly a candidate for considering total hip replacement if they are suffering with a lot of pain and they're unmanageable with conservative measures such as simple pain relief, physiotherapy, hydrotherapy, these sorts of things. Most of the dogs that we see have hip dysplasia, which is a very common disease in young growing dogs where the hips are a little bit too lax, and that can lead on to pain and arthritis and degenerative changes within the hip. But we also see smaller dogs with Legg-Perthes disease, for example, or sometimes fractures, road traffic accidents where the hip has been broken to a point where we can't repair it, or it's healed but in a way that's still causing pain. So in terms of what is done during the course of the procedure, we remove both the cup part of the joint and also the ball part and replace them with prosthetic components that sit in place, weld or heal into the bone, if you like, and form a permanent solution to that joint so that all of the diseased and damaged and broken surface that was there is taken away and replaced with elements that we would hope are going to outlive the dog. In fact, what we find is that once we're past the initial 6 weeks after surgery, only 2% of these dogs are going to come back in the remainder of their natural lives with a problem or an issue with the hip replacement that's going to need attention. And so because we're replacing most hips in dogs that are less than a year old, these hips are outliving dogs that are going to live for 12 or 16 years in the vast majority of cases, which is incredibly good results from our point of view. There are, of course, risks with any surgery that we undertake. We do worry about dislocations, fractures, aseptic loosening of the implants, and of course infections in any surgery is always a concern. Thankfully, we've managed to get that complication rate down to lower than 5% in most cases, and also most of the complications that we see we can successfully revise and still achieve a good functional outcome for our patients. So compared to how things were certainly a decade ago, we've moved forward massively in terms of what we're able to do and help with our patients and the degree of functional outcome that we achieve. So in summary, what is the goal for what we're doing? Well, we really want to get these dogs back out exercising as dogs should. Many people come to me and say that their dog is lazy or never bothers to do anything, and by the time we've finished, they're sometimes telling me that the dog is now really annoying and running around and really intense, and they never realized how bad they were or how badly affected they were with their hips, how painful they were before we started. And it wasn't until after the procedure was done they realized that they didn't have a normal dog. And so ultimately that's the objective. A normal dog able to run, jump, play, and do all of the things that they should do to have a high quality and enriched life. So if you feel your dog is one that could potentially benefit from hip surgery, it's important that you speak to your vet about the symptoms that you're seeing, how they're coping, and then potentially request a referral to a specialist centre with a suitably qualified person that can undertake the procedure and talk you through the whole process and get everything done for you. Just a little bit about the implants that we use. The system that we are using at the moment uses incredibly sophisticated, high-end materials that are, if not as good as, in some cases better than some of the materials that are being used in human hip replacements. We find in our patients, because of the incredible quality of the components that are being used, the longevity of the components is very high, and in a lot of cases outliving our patients. The typical process after a referral has been made for us to assess a patient for total hip replacement initially would include simply a consultation. So having a discussion about what's been going on, having a physical examination of your pet to have a feel of the hips, of course, and see how things are feeling, how painful they may be, perhaps watching them exercise, how do they run, how do they move, and how much freedom do they have. Then we would be quite keen to take a set of x-rays in order to be able to measure the size of the bone, but also to assess the degree and severity of the disease that we can see. And perhaps also, very importantly, making sure that we don't miss anything else that could change the way that we want to treat, and that they are definitely going to be suitable and appropriate to be a candidate for total hip replacement. Then once the decision is made between us that we're going to go ahead, we would book for a day that's mutually convenient, of course, and undertake the surgery usually in the morning when the theatres are cleanest. And then quite often these patients are going to stay in perhaps only for 1 or 2 days after the surgery. Recovery is usually very rapid, and we find that often by day 10 after surgery, many of these dogs are better than before we even started, and that the challenge is perhaps restricting them and keeping them under control rather than having to really push them forward and offer lots of physiotherapy and things. By day 10, we'd want to certainly have a look at the wound in one way or another. And then at 6 to 8 weeks after the surgery, we'd see these patients back for another set of x-rays to make sure that the implants are integrating into the bone in the way that we want them to. After that, we would hope to be able to continue to build exercise back up again, and perhaps by week 12 or 14 after surgery, things can pretty much start to return to normal. Total hip replacement has now become a well-established, well-researched and grounded procedure in veterinary medicine. 15 years ago, I think it was considered a little bit more experimental, but I think now it's becoming more part of the mainstay of normal procedures that we would offer on a regular basis.